on a Medicare fee-for-service program.
Limited prevention screening, no coordinated care, loss of access to certain drugs, accessory things like vision and hearing, supplementals. But more importantly, what's going to be is poorer health outcomes. That's what it's going to be. Or a much smaller checkbook, one or the other. A smaller checkbook, because now the government ain't going to pay for it, you are, or a poorer health outcome. And if your checkbook's limited, the thing that's going to happen is you're going to get the poorer health outcome.
And additionally, the senator from Arizona started by talking about this closed-door meeting, people hiding behind closed doors, secretly trying to come up with things. And there was an article in the paper today that the Democrats are turning to actually throw more people onto the Medicare rolls and the Medicaid rolls as they're trying to come up with some compromise. The idea being it's going to be compromising the care of the people of America. They're trying to put more people onto Medicaid rolls, and the senator from Tennessee has said, you know, it's many physicians don't take those patients because the reimbursement is so poor, and it's putting more people into a boat that's already sinking. So they want to put more people on Medicaid and more on Medicare, but at the same time, they're cutting Medicare by $464 billion. This is a program that we know is already going broke, and yet they want to now put people from age 55 to 64, add those to the Medicare rolls, which is a program I have great concerns about. So special deals for some, cutting out many others, and now adding more people to the Medicare rolls. To me, this is not sustainable, and yet these are the deals that are being cut less than 100 feet from here off of the floor of the Senate, when we're out here debating for all of the American people to see the things that we think are important about health care. You know, jobs are going to be lost in our economy as a result if this bill gets passed. People that have insurance, they're going to end up paying more in premiums if this bill is being passed, and people who depend on Medicare for their health care, whether it's Medicare Advantage or regular Medicare, are going to see their health care deteriorate as a result of this proposal. But I turn to the senator from Arizona who's been a special student of this.
So seniors, by losing Medicare Advantage, would then lose certain provisions that Medicare Advantage provides them. And then they would be forced, if they can afford it, which they're now paying zero because it's covered under Medicare Advantage, then they would have to buy Medigap policies, right? Medigap policies that would make up for those benefits they lost when they lose Medicare Advantage. And guess who offers those Medigap insurance policies? Our friends at AARP, which average $175 a month. So we're telling people who are on Medicare Advantage today, when they lose it, they can be guaranteed if they want to make up for those benefits they're losing, they would be paying $175 a month minimum for a Medigap policy. A lot of American seniors cannot afford that, and that's just a fact. $2,000 a year, they can't afford it.
I would make one other point, is over the next 10 years, 15 million baby boomers are going to go into Medicare. 15 million. And we're taking $465 billion out of Medicare, and if on a real 10-year picture, $1 trillion. So we're going to add 15 million and cut $1 trillion. What do you think is going to happen to care for everybody in Medicare? What do you think is going to happen? The ultimate is we're going to ration the care for seniors in this country if this bill comes through. Life expectancies will decline.
There's 35 minutes remaining.
How many?
35 minutes.
In other words, 5 minutes for this.
5 minutes remaining for you.
Dr. Barrasso, have you treated people under Medicare Advantage?
Well, I have. People in Wyoming know that there's an advantage to being in this program, and that's why they sign up. That's why citizens all around the country have signed up for Medicare Advantage, because they realize there's value in prevention, and there's value in coordinated care. There is value in having eye care, dental care, hearing care. There's their advantages to want to stay healthy, to keep down the cost of their care.
So you are making the case that even though it may cost more, the fact that you have a weller and fitter group of senior citizens, you in the long run reduce health care costs because they take advantage of the kind of care that over time would keep them from going to the hospital earlier or having to see the doctor more often.
Well, that's one of the reasons that Medicare Advantage was brought forth, and I know a lot of senators from rural states supported it because it would allow people in small communities to have this advantage, to be in a program like that. It would encourage doctors to go into those communities to try to keep those people well, work with prevention. And the 11 million people who are on Medicare Advantage in this country, they know they're on Medicare Advantage. They have chosen it. It is the fastest growing component because people realize the advantages of being on Medicare Advantage. If they want to stay independent, they want to stay healthy, they want to stay fit, they sign up for Medicare Advantage. I would think people all across the country who are listening to this debate, who are seniors on Medicare but are not on Medicare Advantage, would want to say, hey, why didn't I know about this program? But as seniors talk about this, as senior centers, and I go to senior centers and have town meetings there and visit with folks, hear their concerns, they're converting over and signing up for Medicare Advantage because they know there are advantages to it. And now for this Senate and the Democrats to say, no, I want to slash over $100 billion from Medicare Advantage, I think the people of America understand that this is at a great loss to them and at peril to their own health as they lose the coordinated care and the preventive nature of the care.
I'd ask the senator from Tennessee, do you know of any economist, any expert on health care that believes that you can make these kinds of cuts in Medicare Advantage and still preserve the same benefits that the enrollees have today?
The answer to the senator from Arizona is no. I do not know of one, and I know of one senator at least who does not believe it, and he is the senator from Florida. And it's interesting that, you know, all week we've been going back and forth, and we've been saying to the Democrats, you're cutting Medicare benefits. And they've been saying to us, oh, no, we're not. And we've been saying, yes, you are. No, you're not. And I'm sure the people at home must say, well, who's right about this? Well, the senator from Florida who sits over there has said, I'm not willing to go back to Florida and say to the people of Florida that your benefits aren't going to be cut if you're on Medicare Advantage, so I want an amendment to protect you. And so does the senator from Texas, and so does the senator from Oklahoma, and so does the senator from Louisiana, and so does the senator from Wyoming and from Tennessee. And so the senator from Arizona is saying, we believe you're cutting Medicare Advantage benefits for 11 million Americans. The senator from Florida doesn't trust your bill. We don't either. We want an amendment that protects 11 million seniors.
I would ask our senators just to expand, just at a brief time we have. It seems like all of the discussion about health care reform has been about accountable care organizations, coordinating care, particularly in the latter part of life, when avoiding chronic diseases and the like. When I was at Kelsey-Seybold Clinic in Houston, Texas, they told me that it is Medicare Advantage which allows them to be able to coordinate care, to hold down costs, to keep people healthier longer. Yet the irony, to me, it seems that by cutting Medicare Advantage benefits is we are going backward rather than forward when it comes to that kind of coordinated, less expensive care. Would you concur with that?
Well, I would concur that this is actually taking a step backward, and that's why the senator from Florida has demanded that they make accommodations for the people of Florida. People of Wyoming want those same accommodations as Arizona and Texas because the people of America, 11 million Americans who have chosen a Medicare Advantage program because it does help coordinate care. It goes with preventive care. It keeps it more patient-centered as opposed to government-centered or insurance company-centered. That is the way for people to stay healthy, live longer lives, keep their independence. I mean, we've seen cuts across the board on Medicare, whether it's home health, whether it's nursing homes, it's hospice care, Medicare Advantage. Across the board, they're cutting Medicare in a way that certainly the seniors of this country do not deserve. They've paid into that program for many years, and they deserve their benefit.
If I may say to the senator from Arizona, one other thing, we've talked a lot about our good friend, the senator from Florida, and how he's been so perceptive on noticing that his Floridians with Medicare Advantage may lose their Medicare benefits. I hope he's as perceptive.
Senator's time has expired.
Additional 30 seconds for the senator from.
Without objection.
I would ask the senator from Arizona, I believe there are other Medicare benefits that are likely to be cut in this bill. Aren't there cuts to hospices? Aren't there cuts to hospitals? Aren't there cuts that to home health care that we talked about yesterday? So if Floridians don't trust the Democratic bill to protect their Medicare benefits from Medicare Advantage, why should they trust the Democratic bill to protect any of their Medicare benefits?
Could I finally point out what Dr. Coburn said? Medicare Part C, which is Medicare Advantage, is part of the law. And to treat it in any ways different because those on the other side don't particularly happen to like it, I think is an abrogation of the responsibilities we have, the seniors of this country. I thank my colleagues. I yield the floor at this time.
Madam President.
Senator from Texas.
Madam President, I rise today